The following presentation was made possible by supporters like you. Consider making an impact today by honoring Science for Georgia with a gift, or by joining our Catalyzer network. Thank you, and enjoy.
So today I'm going to talk about the effects of extreme weather events slash climate change on perinatal and child mental health. So my background, as you could probably tell, is in perinatal mental health. So perinatal is everything from conception through the first year postpartum. So there's this whole area of psychiatry that's called reproductive psychiatry and is focused on mental health issues in those childbearing years. The child piece is a little bit added on, but I feel like I have to talk about the mother child. It's called the mother child dyad. So both the mother and the child, because that relationship is so interconnected and the health of either is so dependent on the other that I kind of present both sides of it in regards to exposure to extreme weather. So the first part, I'm going to talk about child mental health, and I have two children of my own, and I am very invested in child mental health and child health in general. I will say at the second part of my talk, I talk about I focus on moms. So, and when I say moms in this context, perinatal, so pregnancy through the postpartum, even though all moms that are aware of climate change and you know care about the health of the planet are impacted. My focus is on perinatal just because that's my background. So this first part is actually published, and this I don't know kind of how many of you are kind of acutely aware of climate change and where we're okay. Good. Okay. So some of this is going to be um, old hat. Uh, we know that extreme weather events are intensifying, they're more frequent, and they're harder to predict. And areas that were considered high risk before, that whole high risk category is broadening, right? It's not just coastal Florida. It's not just wildfires in California. It's broadening and it's happening fairly rapidly. I think a connection people don't necessarily make is that climate change impacts human health, right? It's not just infrastructure and landscapes, the air we breathe, that all translates into organ systems and how it affects the human body and also your mental state. Um, Children and women are a vulnerable population. I think I saw a statistic recently that said something like 80% of those displaced are women and children. So, a large portion of the population that gets hit by extreme weather impacted the most are women and children. So there are both physical health ramifications and mental health ramifications. So this first piece we did sort of an official and it's published review of the literature in the child mental health arena around exposure to extreme weather. And what we noticed when we reviewed the maybe 80 some articles was that most of the literature focused on like a singular event. So there's a ton of research in the area of Hurricane Katrina, right? So looking at what happens to children that were exposed, well, what happens to people that were exposed during childhood to Hurricane Katrina or various other events, but it was like a singular event. So what we did is we kind of gathered all of that literature in that area that related to mental health and extreme weather and children and looked for themes that were kind of consistent across that literature base. And we kind of looked at the standard websites to, I mean, I'm sorry, the standard databases to look at the gather the articles. And we kept kind of reading through them and then we ended up grouping them by theme. So the things that we found, and this is where I have a lot of qualitative health research background as well as quantitative, that really came into play and was really helpful was in reviewing the literature. When I try to kind of tell the story of what we found, the themes that we found were there was sort of theme around psychological symptoms and behavior, potential for long term effects, the protective factors. So, protective factors are things that help you stay healthy. Risk factors are things that do not promote health, right? So, smoking is a risk factor in most chronic diseases. And mental health has its own. So, with mental health, social support is almost always a protective factor. Implications for screening and treatment. That's not the focus of this talk. That is not my area of expertise, but it's something that I touch on. So, in the child mental health literature, and that was everyone up to age 18, right? Anyone that a pediatrician could see. We found that there was actually an array of psychological symptoms that were reported on in the literature. And this is, I say this too in contrast to the women's health literature, the maternal health literature. The data here is so much richer. It's striking. It's not that the base of literature is so much broader, it's that the outcomes that are studied are broader. And I think it kind of swings back to this whole theme that if you're in reproductive psychiatry area of research, you realize that the moms get kind of tossed off to the side. They're just never the primary focus, and this is something we battle. It's gotten a lot better. Postpartum depression kind of kicked off the whole awareness into perinatal mental health. It's not where it needs to be, but we've gotten a lot better. But that said, the child literature is just a lot richer around extreme weather events and mental health. So you can see that they the range of behavior that's looked at is everything from kind of like infancy and people that are children that are exposed to extreme weather up and through even adulthood and diminished earning potential as an adult. Impaired functioning, PTSD is a really probably the biggest area, the richest area in the child literature is post traumatic stress. It's just a very high percentage of children exposed to extreme weather have some kind of post traumatic stress, which makes total sense because it's a trauma. Anxiety, depression, etc. But what's striking is that the child is followed so much longer. Um, in terms of longitudinal research, it's a lot better than what we look at in the moms that are exposed to extreme weather. And this is, again, this is consistent across research. And that there's this saying in my field that, it's like candy and the baby is the candy and the mom is the wrapper. And when the baby comes out, the wrapper gets thrown away. And that's kind of that's not to beat up on our system. It's just an indicator of the fact that we don't focus on the mother's mental health and that very serious and just adjustment to motherhood. And when I say adjustment to motherhood, it could be your first child or it could be integrating another child into your family unit and all of your other responsibilities. It's just not taken as seriously as it needs to be. So, that said, in the child literature, there was a lot on the potential for long term effects in children that were exposed to extreme weather. So, wildfires, storms, floods, etc. Multiple studies, there's a lot of evidence that that kind of exposure or trauma can cause long term mental health effects. A big, and you're going to probably get sick of hearing about this, is the two things that were really big and stood out were in terms of impacting recovery, mental health recovery from this type of event, or the chronicity. So, was it, if it's one flood, people can kind of rebound, the community can rebound. If it's chronic and that an area is getting hit over and over and over, the community can't bounce back. And then the individual can't bounce back, and the parent can't tend to the child because they're so completely consumed with provision of basic needs like electricity, opening schools, etc. So, level of exposure and the chronicity of the event are key in driving all of this in terms of trajectory and recovery in terms of mental health from extreme weather events. And that's for both the child and the mom. So, some protective factors that came up in the literature over and over again were, of course, and again, this could apply to a lot of mental health events, right? Your level of resilience and coping is going to impact your recovery, not just in terms of extreme weather, bereavement, divorce, anything, the more complex and adaptive you are in terms of your coping, the better your outcome is. So that's not a huge surprise. Another thing that was really important, and I kind of highlight this because it kind of speaks to the rest of the talk, or caregiver emotional support and the quality of the parent-child relationship, and if the parent was present at the time of the event. So something that's really traumatic is if there's an onset of extreme weather and the caregiver is not present. I mean, and that makes total sense. The child wants the caregiver there. Um, Household air, some practical issues, household air conditioning, green space, all protective factors in terms of mental health and exposure to extreme weather. And I'm talking about heat illness too. I think what worries me is that the extreme weather events, people think of hurricanes or wildfires. Those are kind of obvious. But what I worry about is heat illness, right? So, oh, it's a hot summer in Georgia. People don't realize. I think a lot of people are going to get caught flat-footed with the, heat illness because it is getting hotter, and that impacts air quality, and it impacts your body's ability to adjust and cope. So anyway, so household air conditioning and green space are also protective factors. Also, positive reappraisal and post-traumatic growth, that kind of folds right in with coping and resilience, right? Can you reframe the event as something positive? And that again would apply to a number of traumatic mental health events. Risk factors were older age, female gender. What what's interesting about that is female gender predisposed you to depression, anxiety, PTSD, but it also went in females. They had a better ability to bounce back or grow. In terms of post traumatic growth, they had better potential, which is kind of an interesting, it's almost like a contradiction. So, in a way, they get hit harder mental health wise, but also have the ability to grow at a faster pace as a result of the event. Again, degree of loss. Did you lose your place of residence? Did you lose utilities, or the schools shut down? Did you have to move? Did you lose your healthcare providers? Did you have to kind of change your whole system around you and adapt because you were displaced due to climate change? Also, what you were headed into the event with, and this is again consistent with other types of trauma. What was your story right up to the event? Did you have negative, friendship interactions? Did you have low social support? Did you have lower socioeconomic status? All of that puts you in a riskier category than if you have lots of resources, both human capital and financial capital. And kind of the last part of the child talk that I want to mention is that post traumatic stress in the child population, at least as documented in the research, is very high, right? Up to 71% of children report post traumatic stress in the aftermath of disasters. However, only 5 to 33% access counseling. So, like with many other mental health issues, there's a bottleneck between identification of the problem or just experiencing the problem, which in this case is extreme weather, and being funneled into a kind of a treatment and recovery path. And part of this with extreme weather is that the community at that point is consumed with the provision of basic needs, getting back on their feet, opening schools, getting everybody's utilities back on track. Just sort of these basic needs where mental health, again, pretty consistent with other traumas, takes the back seat. And you can understand why. As a parent, you're pretty consumed with the basics. However, what is out there, and this is not a rich portion of the literature, the published reports that are out there indicate a lot of value in post disaster screening and treatment. So parents and children are happy with it when it happens, it just doesn't happen often. So the conclusions in terms of the child portion are EWEs are more frequent and severe, and that kind of applies across the board. Children are disproportionately affected by climate change in general. physical and mental health are potentially affected, the mental health ramifications can be long term, depending on an individual's situation. Risk and protective factors combine with exposure level to influence recovery trajectory. So how resilient are you? How rich is your social support system? Do you have the help around you and the resources to bounce back? And what was your level of loss? Was someone injured? Were you injured? Did you lose your home? Did you have to move somewhere else and lose your whole social support system? So how directly and severely were you impacted? A lot of work remains in terms of post disaster assessment and intervention. There isn't a lot of literature on it, and I suspect it's just because we don't have a real solid system in place to screen people for trauma after disaster exposure, and to kind of funnel them into a effective treatment situation. And also, and this is something that we preach in our field, we try to educate other healthcare providers in terms of the risks of climate change. Not every healthcare provider is aware of the array of organ systems and impacts, even on medication storage, skin health, eye health. All of this is impacted by our environment. So this is something that, again, I always feel like we put everything in the lap of our primary care providers. They should be screening for environmental determinants. They should be screening for mental health. I feel like we throw so much at them, and it's kind of an oversimplified recommendation because they've got a packed room of patients and they have to deal with the clinical outcomes of the patient. And we're asking pediatricians to screen moms for mental health. We're asking, what's that? Oh, I thought somebody says, we're asking obstetricians and gynecologists who are not trained in reproductive psychiatry to treat the mother for mental health. So I say this not to oversimplify, but again, in some rural areas, your PCP is the only game in town. And unfortunately, with what's happening with the climate, they need to be aware. So just shifting a little bit from the child to the mother, because I look at them as just so inextricably linked. The mother kind of safeguards family health. And this is not to put guys down. My husband's great. He's a great nurturer. He's good to my kids. But the mom is the one remembering, when the vaccines have to happen and when the dental appointments. In general, that's kind of a tendency of mothers to kind of be the lioness of family health. So the mom's health is real important to the entire family unit. And if she's not tracking and in good shape, there are ripple effects. So this next part is more focused on perinatal mental health. So again, I'll just kind of restate, all mothers that are aware of climate change are impacted by what's going on. Just because you have, an 8-year-old and a 10-year-old, you're still thinking about, you know, the, you know, the asthma rate is going up. What's this all about? Or my kid threw up at tennis camp and it was 98 degrees out. You know, all of that, if you're thinking and you're aware, it wears on you. So, point being, all mothers are impacted, but we took a special look at pregnancy and postpartum and how it was impacted, or at least what evidence there was about the impact of exposure to extreme weather during pregnancy or the postpartum on mental health. So I just want to kind of review. If you think about what we talked about with children, what was really important and a protective factor was the availability of the caregiver, right, at the time of the event, the quality of that relationship between the child and the caregiver, and that the caregiver is available, there's quality relationship there, and that they're present. So my point is that the role of the caregiver is extremely important to the child. So it's important to the mom, it's important to the child, it's important to the family unit. That's why I tell both sides of the story. So, and I'll just kind of give a disclaimer here. Caregiver can take on different forms, right? An older sibling can be in some ways a caregiver. A grandparent can be a caregiver. The dad can be the caregiver. The focus here is definitely moms, and part of that is because that's my field of research. And also because what I just mentioned, that mothers are often, regardless of employment status, mothers are often the primary caregivers. Um, Also, the interesting thing about the perinatal period is that disruption in that period has implications for prenatal care, right? You're seen by your doctor over and over again in that prenatal and in the postpartum period. You have well child visits with a pediatrician, so that's kind of a time of intense medical evaluation. So imagine being displaced during that period, and you like your obstetrician and you're scrambling for prenatal care, or you're scrambling to find a new pediatrician for your child. So it has real practical ramification in terms of your medical care. Also, a choice to conceive. I've heard mothers say, do I even want to have a child? I mean, is this sustainable? I've heard my own children say, "Mom, I want to live. What if all the bees die? What happens?" Over and over and over again. So, when you think about it from that perspective, and you think about having children, in a way, it's an act of optimism to have a child, right? Because you're betting on humanity to be able to kind of hold the line for the environment. Also for the family unit in that perinatal period, also, especially the postpartum, well, primarily the postpartum, that early bonding period is so important to the child in terms of development, both cognitive and behavioral development. And that first, 3 to 6 months is incredibly important. So that period is important. It's a time of vulnerability. And I just kind of, just to illustrate here, if you looked at these two moms, and this isn't a judgment thing because we've all been in both circumstances, who looks best equipped to provide immediate emotional support. You've got one mom who's looking directly at the child, and one that looks really stressed out, right? So I'm just kind of driving home the point that the mom's mental health is so important to the family. And just to kind of give you some background about perinatal mental health, this is outside of exposure to extreme weather, that perinatal mood and anxiety disorders are the most common complication of childbirth. So, approximately 1 in 5 to 1 in 7 women will experience postpartum depression or postpartum anxiety. The prevalence of those two is kind of like neck and neck. So, the most common are depression and anxiety. There are some more rare but really extreme and unfortunate conditions like postpartum psychosis that are, they're, I think, 1%, but they're very, very, very serious when they happen. So, again, this is a time of intense vulnerability on the part of the mom. Um, Also, it's a huge public health burden. Have you guys heard of the phrase like public health burden? So I'm public health trained, so we always think about, you have rare conditions that might be really serious and severe, and they impact the family in really deleterious ways. But they aren't the burden on society isn't immense. Well, here the burden on society is immense, right? So this group called Mathematica did a cost study and estimated that the cost of untreated perinatal mood and anxiety disorders was almost 15 billion for all births in 2017, and they continue to kind of follow up. So this is a high impact problem. Also, the effects on the child. So mothers with kind of moderate to severe PP, postpartum depression, there's kind of an established impact on the child's development. So we've seen failure to thrive, attachment disorders, developmental delays, problems in school, behavioral issues, all by age 1, and that impact can persist all the way through adolescence. So there's kind of a lot going on in this period, and I'm kind of hammering this because there's so much happening in this period that imagine adding on this other trauma of going through a hurricane and needing to leave your home residence. We have hormonal changes, changes in body image, breastfeeding, sleep disruptions, do you have adequate social support, or do you have no one to help you? Do you have a reliable partner, or is the partner more of a stressor? You might be managing other children. It's an identity shift in a lot of cases. Um, it causes, in a healthy mother, reprioritization, right? So maybe you can't do everything you were doing before you had the second child or the first child, and that's okay. That's a healthy adaptive process when you are sorting through, here are my list of activities. Here's what's got to go. Here's what's still working. Here's what's essential to my mental health, and here's what I cannot do anymore. And I always think of it as a spiraling outwards. You have the child, you're focused on feeding. Is breastfeeding working out, or is it really hard on you? Bottle feeding, you want the baby to be gaining weight. You want, once the baby sleeps, your mental health starts to fall into place a little bit more. But as you adjust and adapt, and a healthy person, you can kind of take on a little bit more. Again, this isn't kind of a healthy person, so I think of it as a spiraling outwards. And these are actually my kids. Are in the next room, but I kind of make a joke here, because when we were native Pennsylvanians, and we moved here 10 years ago because I got a faculty position at the medical school at Mercer. And I was pregnant with my daughter in the first year we got here. And so, we didn't know anybody here in Georgia. So we had kind of no support really. And I had a 2-year-old son who's right there, and my daughter who just didn't sleep for about 2 years. So my husband was at the end of his rope, because I was still working like a conventional work schedule, and he was getting up with her a lot. And at the time that this happened, my cousin, who we're really close with in Pennsylvania's wife, they had 3 kids, really young kids, had a breast cancer diagnosis. And it looked good, her prognosis was really good initially, and it just did not work out that way. She ended up dying and leaving him with 3 kids. And as this was happening, I remember walking past her rocker, her like electric rocker, and thinking, oh my God, like, I'm like the meal ticket. Like, everybody's dependent on me. And if I don't pull through here and live a long time, this impacts my son, my daughter, my husband. So I went and got more life insurance, and that kind of, in a way, that fear is protective, but it's also very anxiety provoking. But they're all good. This is them at the Christmas parade this year, and I use this in a different presentation, just to show that in Macon, Georgia, it was 73 degrees in December. I showed this in Pennsylvania. Um, but there are a bunch of risk factors for perinatal mood and anxiety disorders, right? I kind of mentioned, like, the body image issues, but what if you had to go through fertility treatments, or you have a family history of mood and anxiety disorders, or you had postpartum depression with your last 2 kids, thyroid changes, sleep deprivation, all of that puts you at greater risk for something that is already really common. And the other thing is trauma. And this is where I get to transition to the climate change effects. So I looked up, just kind of did a quick Google search for questionnaires that ask about trauma, traumatic life events. And the first one I saw on the life events checklist was natural disaster, right? So happened to me, witnessed it, learned about it, part of my job, not sure, doesn't apply. So this is a major risk factor, and potential drama that is becoming more and more frequent with every year. So to kind of follow you through my line of thinking, extreme weather and climate change is affecting more people, more geographic regions, and that equals more mothers, right? Mothers are a big part of society, a big, if you think about percentages, it's a big piece of the pie chart. We already know that women and children are especially vulnerable. I think I mentioned displacement in 2019. The estimate was almost 25 million people were displaced, and that I've looked at that estimate. I can't remember the exact figure, but it's projected to grow exponentially as it, globally. That's globally. Yeah, globally. Um, and the other thing is too that at least in my world, I noticed that eco anxiety, climate despair, these terms, they are tracking in the mainstream media. How many of you have kind of seen those terms or heard them referred to? Okay. So yeah, they're not obscure. There's not a lot of research on them, or especially longitudinal research, but they are in actually in a way the mainstream media has done more service to this area than research. They just kind of got out ahead of it. In my view, they got out ahead of it a little bit, which is great because a lot more people are touched by mainstream media than they are reading these journal articles that I read. But I will say that children are much more the focus than the mom, just like in every other area of research. Which is a mom, to me, I look at it and think, when I, if that's that whole going back to walking past that swing where my daughter's rocking back and forth, thinking, I need to live a long. I mean, that's all I could keep thinking. I need to live. Oh my God, she's 0 and I'm 35. Like I need to live. Doing the math there, I need to live a long time. Um, so anyway, my point is that the mother is just still secondary, and if you think about how we treat them clinically, you go in, I had 2 C-sections. I went in, I was seen twice, one for each. And it was how's your C-section scar? How's feeding going? And I'm not laying this at the doorstep of the obstetrician. They are taxed and they are doing the best job they can to attend to the clinical outcomes of the pregnancy. My point is I came out of there feeling like, wow, I just had this major surgery, and it's just like, go home and kind of repair yourself and simultaneously figure out how to feed this kid. And it just seemed, I guess, inappropriate in terms of the gravity of the event. The response clinically seemed inappropriate, but I get that from my aunts, and it's all about the child. It's all about the kid. It's nobody. I had a mother say to me once in downtown Macon, we had her take this questionnaire, and she looked at me and said, nobody ever asks about me. And she wasn't complaining. It was just this in earnest response to, it's, how is your C-section scar? How's the baby feeding? How are they sleeping? Baby looks great. Okay, go home. I mean, that's kind of where it's at. So again, and this lack of focus on pregnant and postpartum women is true in vaccine research too. It's a true across all. They call it the last therapeutic orphan, right? The mom, because there's all kind of fears to it, and some of it's honest. It's that when you treat a mom, there's fear too because you're treating the mom and the baby. So there's liability there, right? So if you're testing a drug, you're testing it on the mom and the baby. Or if you're testing a drug and the postpartum, you're testing the mom's breastfeeding, you're again potentially affecting the mom and the baby through transmission through breast milk. So there's a lot of risk there, and that part of it I have a lot of sympathy for. But in general, in this country, we are not real sensitive to the mom's needs. And this is kind of my major, this is a line off my research that's focused on maternal functioning. So I kind of I just thought about this. How does what's out there right now, and I will tell you what's out there right now in this area on pregnant and postpartum women versus children, the mom literature pales in comparison. There isn't the richness of data. The outcomes that are looked at, if you think of a range, it's like this when the child research is like this. And we're still talking about a pretty new area of research, relatively speaking, in general. But what I did find pretty much agreed. So in the maternal literature, I found that as the level of loss increases in terms of your exposure to extreme weather, depression and anxiety prevalence go up too. Totally makes sense. As exposure level, are you wading through the floodwaters? Are you breathing in the wildfire smoke? When that goes up, the mental health problems go up. Totally makes sense. Totally in agreement with the child literature. In terms of PTS, post traumatic stress and post traumatic stress disorder, uh, it's in agreement with the child research, but I can tell you, and there are a handful of studies on moms. There are a ton of studies on kids, a handful on the mothers. But what is there is an agreement that is the more exposure, when I talk about that chronic event, you're getting hammered with the hurricanes versus a one off. You see the difference in terms of the stress level in the mom, same as the child. Again, this is I think of it. It doesn't sound like rocket science because it's like a dose response relationship. The more trauma you have, that's going to have an impact on your mental health. And there are a couple qualitative studies where they asked mothers that were pregnant during extreme weather events, what did you worry about or how did you feel? And this is a real short list, but things they worried about were food insecurity, access to healthcare. What if we have to move? Losing their medical home, financial worries, housing concerns, the evacuation process. All of those things you have to think about when you are pregnant or postpartum. You're thinking about your health and keeping either the fetus or a newborn child and your existing family healthy. It's a lot. The other thing that was in agreement was role of social support. And I always think of social support. If you think about smoking, right? You always hear about smoking, impacts almost every chronic disease prevalence in a negative way. Have you ever heard of a health benefit to smoking? Anybody? In ter- Maybe immediate relief of anxiety, but a longer term chronic path, you never hear about it. And there are very few factors that they're that direct of a relationship where you can almost say it's causal. It's very, very hard to say something is causal because not everybody that smokes gets lung cancer, right? So, but I always think of social support as almost like it's that strong of a relationship with mental health. So almost always social support is connected to better mental health outcomes. Just like exercise is almost always protective. So it's that strong. And in terms of the maternal literature, the quality of the partner support, so your spouse or your partner, was associated with less depression in the mother. Um, Also, there's a whole, and I don't get into this here because it's touchy area in terms of the maternal mortality and morbidity issue. There's a lot of there's a body of growing evidence that exposure to extreme weather during pregnancy lends itself to all kind of negative child outcomes, not just mentally, developmentally, cognitively, but also in terms of pregnancy outcomes, head circumference, gestational age, gestational weight. Um, I don't I don't go there just yet. I kind of focus on mental health here, but it definitely looks like there's something happening. It's across so many different health outcomes that there has to be something going on there. Also, what's really interesting is even though women, so kids that are female and women, have sort of a more higher predisposition to depression, anxiety, PTSD as a result of extreme weather exposure. They also, again, in the maternal literature, have a greater propensity for post traumatic growth. So get hit harder, but seem to have more capacity to adjust. Again, this is not a literature base of 4,000 articles. It's still a new and growing area, but it came up in both populations. Um, again, that's in agreement with the child research. And I kind of mentioned this already. This is what's coming up in terms of maternal stress during pregnancy due to disaster exposure, natural disaster exposure, uh, pregnancy complications, negative birth outcomes, difficulties with infant temperament, childhood anxiety, childhood obesity, and HPA access regulation in the child has been linked to maternal stress due to extreme weather. So my conclusions are that the perinatal period is already vulnerable for negative mood symptoms. EWE exposure or climate change, heat illness, whether no matter which form it comes in, represents a trauma. Trauma is an additional burden during an already challenging time. EWEs are more frequent and intense, so there's more trauma available to the mother who is pregnant or postpartum. So, as this public health crisis grows, this will grow in proportion. Also, healthcare providers are already expected to screen for perinatal depression or anxiety. Healthcare providers that deal with women in this age range, who are in the childbearing age range, who are pregnant or postpartum, are already recommended and expected to screen for depression slash anxiety, depending on the clinic and the state and all kinds of other circumstances. This will be crucial as our climate crisis continues because, again, more more geographic regions are affected, more providers will be affected, and more patients will be affected. When you think of the pie chart of patients, moms and kids are right up there. Also, the current research in both areas, both with the child and the mom, is not super robust because, again, if you really think about climate change, I mean, those words have been taboo as recently as maybe 5 years ago. I mean, this is only now kind of really breaking into every day. It's in political debates. If you think 10 years ago, it was, oh, should we mention climate change or is it global warming or what do we call it? Or I think so. Research takes time to do. So, in a way, I think that's why the media can latch on faster because it doesn't take 4 years to do a longitudinal study. Um, yeah, there are not enough EWE. There's a lot of in the child literature. Hurricane Katrina is a big focus, so that's one type of storm, right? And the mom literature, it's basically two studies that have really produced a lot of this research. It's Project Ice Storm and the Queensland flood in Canada. That's where the majority of the research is only from two different weather events, two different studies. So again, small literature base. Um, so I think kind of I'm putting it, I don't hear this talked about a lot. I hear it talked about with kids and climate anxiety in general. The perinatal part, I have not heard it talked about much. And it's been really obvious to me, I think, because that's my area. Also, because I worry about my kids. When my daughter throws up at tennis camp because it's almost 100 degrees and nobody pulled them back in and told them to drink water, I'm thinking going forward, are summer camps in Georgia even feasible? As my own asthma gets worse in this state, I think, now I'm in better shape now because I'm on allergy shots, but can I continue to live here? If you think about Metro Atlanta, I think the asthma rate is like something like Rebecca Phillipsborn, my colleague back there, can interrupt if I'm not correct on this, but I think it's like something like almost 1/3 of children in Metro Atlanta have childhood asthma. If you're a mom and your third kid develops asthma and you're aware of all this, you've got to be worried. So the silver lining is that there is value in post disaster screening. When it happens, it works. It just doesn't happen a lot. All the major organizations, ACOG, the American College of Obstetricians and Gynecologists, AAP, American Academy of Pediatricians, APA, which is also American Psychiatric and American Psychological Association, and the U.S. Preventative Services and Task Force all already recommend that we screen women in pregnancy and postpartum. So, in a way, that infrastructure is already there. Now, not everybody's doing it, but it's there. The recommendation, the protocols are there. We are better now at recognizing postpartum depression, postpartum anxiety, perinatal depression, perinatal OCD, perinatal PTSD, all of that. We're better at it, so we're much better situated to incorporate this other additional trauma that's becoming more frequent than we were, say, 10 years ago or 15 years ago. This is part about nurses. This was for a nursing presentation. I'll just say that anybody in here a nurse? Okay, so the the reason I had this in there is I did this for a nursing college, and it just happens to be that nurses 19 years in a row are ranked as the most ethical and trusted professionals of any profession. So when I talk to nurses, I kind of say, we need you. We need to leverage your trusted voice as a healthcare professional to talk to people about the health risks of climate change. Because not everybody is making the connection, including healthcare providers. There's an organization in Georgia called Georgia Clinicians for Climate Action, and that is one of our core goals: is to educate other healthcare providers and the public as to the health risks of climate change. And there's supposed to be a question slide, but this blank slide is my question slide. So
Earlier, you mentioned how women are more vulnerable to effects of trauma from disasters and climate change, but also more resilient. How much do you suppose is due to the female psyche, and how much to our society and our culture that women are often essentially second class citizens, or that the child gets all the attention? Because you mentioned most of the studies focus on the kids, and oh, yeah, because the studies focus mostly on the babies or the children, but very little is focused on the mother. So, how much of that extra stress do you think comes from society where the woman is essentially ignored or treated as not quite human?
you mean like the higher incidence and depression and anxiety and I don't know. I've thought about that. I think women in general, and Elizabeth, correct me if I'm wrong. Elizabeth is a mental health care professional in the state of Georgia. I think women in general have higher rates of depression. Yeah. So that makes sense, and that kind of loops back to my whole point about the woman being the kind of the caretaker of the family. Again, if you're aware and you know that that's kind of your role, one of your roles is to protect your families, be the lioness of family health, and that third child has asthma, that's going to work on you and potentially a different way that it works on your partner. So I think all of that kind of bleeds into the whole, maybe an awareness, maybe a kind of a role based disposition. Also, just women have more anxiety and depression. Elizabeth, am I right on that in general?
Well, first of all, Jennifer, your slides and your presentation and talk tonight was excellent. I just want to say that. So good. But I just think that the stressors on women are markedly different and marginalized folks. I mean, the whole intersection of BIPOC people, and we have to look at the whole aspects, but we have to start paying attention to the impact of ignoring the mental health of mothers onto the whole culture. Yeah, and yeah, I mean, there's so much to say about that.
One other thing I was going to say about that is that women, where it's consistent to other age groups, is women are also better at networking and to kind of reaching out socially. You ever hear that, like the guy kind of tends to isolate when there's a mental health issue, but women reach out. I think that's where that adjustment piece comes in. Like they're hit hard, they're sensitive, they take it in, but then there's potential for growth in the way that they adapt to it. That would be that's when I've thought about that relationship, that's been my theory.
The North Atlantic hurricane season is forecast to be extremely active this year. And I'm just curious, how would that potentially bad situation help you further your research? Hurricane season.
Yeah, I don't know that that directly, well, there are more people affected. So there are more people you could interview. For example, for one of our projects on climate distress, we interviewed coastal Floridians, mothers, and farmers. So I kind of took a cross section of groups that I could access, right? Because research isn't just about the optimal. Optimally, I'm interviewing people in California with wildfires and this nice broad swath, but it's also there's a feasibility part of research that you have to build into who you can reach feasibly. Um, so we interviewed the coastal Floridians, kind of that they kind of captured like the hurricane, storm issue. The agricultural workers could speak to the economic impacts. So, I they would tell you, we can't work the same. The growing seasons are different. It's hard to motivate my staff because we'll have rainfall for 11 days in a row. And we even had one guy say, he said this directly. Yeah, I don't know if we're going to win, meaning win against climate change, but this is a hoax that's made up. He said that in the same sentence. I mean, it was unbelievable. Now, most people did not. Most people acknowledge that there's a problem. This is what's causing the problem, and this is how it's affecting me. But there was still that disconnect in that one person. He could tell you all about the economic impacts and the morale issues and his staff and etc. But he still had that disclaimer. Oh, this is all made up. This is a hoax made up by the Democrats, is the way he framed it. But again, if you look at the opinion polls, they're all going in the right direction in terms of, thinking about buying electric cars. I think it's the highest percentage ever. The people that would want are interested in electric cars, and it's all moving in the right direction. And the technology is, for the most part, I think there. It's the political will piece is the part that scares me. I almost hope that industries, the will to make money and to implement solutions and that are profitable, kind of pushes the political will thing off the table, because I think it's almost impossible to get everybody on the same page on this issue. Globally, it's really hard. But I didn't totally answer your question. That won't directly impact my research, but there will just, the more people that are affected, the more potential research subjects there are out there. And also, I think what will get looked at eventually too is areas that aren't used to that. What that adaptation process is like. They're not, they're probably planning wise are not as far ahead. I mean, I think Boston, coastal areas. But I mean, I grew up in Pittsburgh and it was 93 degrees there one day last week. We didn't see 93 degrees until maybe August when I was growing. I mean, it's everywhere. It's absolutely everywhere. It's impacting some areas more than others.
Cool. So you mentioned multiple times that the best way to get to new moms is through either pediatricians or their OBGYNs, but then also that it's a lot to lay at the feet of an OB or a pediatrician. Um, so how do we fix that? Because speaking from personal experience, I had the same experience you did, right? I had a C-section. I had twins. No one gave a crap about anything that was happening to me. The first physician that has ever asked me how I'm doing is my kid's dentist. And I will go to that guy until he dies after this, right? Like I almost wrote him a thank you. I cried on the way home because he was like, "Are you okay? That filling was a lot for your kid," right? So, what do we do if it's too much for the OBs or the pediatricians? What's another solution? Like how do we address this?
Yeah, it's a big problem, and I think too it's a bigger problem in rural areas, right? I mean, in rural areas, they're not just. I mean, they can't even worry about mental health professionals. They might have one primary care provider servicing the whole area, or they have to travel extensively just to get basic physical needs taken care of. One thing that I've heard about more is called integrated. It was integrated care, right? But integrated OBGYN clinics where you've got a mental health professional right down the hallway. So that way, if the OB screens and they have a positive screen for depression or anxiety, they have somewhere to send the woman, because that's a lot of the barrier is, if I get positive screen, what do I do with them? So if you have somewhere to send them, that facilitates kind of a better path for the woman and the provider. That in clinic stuff is pretty rare, at least on the East Coast. The people that have been writing to me lately have been West Coast, and they're like, "Oh yeah, it's common." I'm like, "Really? I don't ever hear about that." But that's ideal, right? So I work with Houston County Public Health, and they now have a psychiatric nurse practitioner on staff and a marriage and family therapist 1 day a week for anyone that comes in with any problem. They have in-house mental health care. That's the ideal. That's absolutely the ideal. That kind of takes some of the onus off the primary care provider that's trying to attend to, pediatricians will tell you, the mom's not my patient. The child's my patient. I don't have access to the health records of the mom. And it is expecting a lot. That is not in their core curriculum as medical students, but we expect it of them. So, I mean, I'm in a medical school. I have a lot of kind of compassion for that argument. I mean, mental health care in the clinic home is the answer, in my opinion, and better insurance coverage.
So, Jen, one thing that I know is that at the VA, there's a lot of PTSD research that they were doing, combat PTSD specifically, and sexual trauma. One thing they've found and have been studying recently is giving vets injections of progesterone as protective against traumatic, preventing PTSD development. So I think that may be one of the things that women have as an advantage for recovery, but I don't know specifically on that one. Have you heard more about that research? Progesterone injections and treatment.
So the first hormone based treatment for postpartum depression came out maybe 5 years ago. It's called brexanolone and now called Zulresso, and it's an injectable, but you have to be, well, now you can do it at home too. One of the barriers with that is the first ever postpartum depression specific medication ever. So it was FDA breakthrough status. Big deal when it came out. There's some issues with administration, and that the woman initially had to be in the hospital to receive the injection. That is, from my understanding, now you can get it at home for severe postpartum depression. And it's hormone based, first ever. So normally, if there's a pharmacological need, it's Zoloft and, uh, I don't know what the kind of Paxil's kind of been almost blacklisted. Um, kind of some of the typical antidepressants for other maladies, but that is the first hormone based. They have a oral formulation too that I hear is testing pretty well. Progesterone specifically, I don't know as much about. I don't even know if that's been tested to really make a comparison, but the brexanolone is hormone based, and it was kind of produced a rapid response. There were just some costs and administration issues to it.
Just wanted to start off. Thank you for being here, talking about science. That's awesome. There's really not much better than that. Um, I'm not trying to dig in, but I do find the statement that women are more predisposed to depression is very interesting. And I just want to clarify maybe on like a environmental or chemical basis, because older men are like 3.88, almost 4 times more likely to kill themselves. And yeah, so it's just like a weird, like, kind of place. Like it's imperative to talk about because it's mental health, and it's hard for it to become a tug of war. And I think the tug of war is important because it's a matter of assets in the past have not been allocated to women, and that's part of the thing. But yeah, I'd just love to maybe get a little more clarification there.
Yeah, and it's probably, I haven't looked at it like broken down by age groups. I think that's kind of a general all age kind of comparison that you see that depression and anxiety are a little higher in women, at least everything I've read. But again, women are more apt to seek social support and they live a little longer. So there's that part of it too.
In the point you made, a key word also comes back to resilience. And I kind of feel like that is part of what they're talking about when they speak of resilience.
Well, and this is kind of something that we talk about with, at least in the postpartum and perinatal, is like you hear the word self care, and I mean that applies across all, both genders, all age group, everything is self care, but it gets thrown around a lot, and I have always been interested in that because in women, what you'll see is when you interview them in the postpartum, they'll say stuff like, "Well, if my, when you become a mother, it's all about your kids." And then sometimes even the same mother will say, "But if I'm not healthy and happy, my whole family will be miserable." So it's like this weird tension between, oh, it's selfish to take care of myself when I have a kid. And I think women really struggle with that. And there's a lot of cues from society that make you struggle with that. And I think what I've noticed anecdotally that women that have kind of strong female mentors that have kind of juggled a lot of things in their life and their kids never felt like they weren't attended to because they had a career, seem to fare a little better. Um, but what I will say about self care, the older I get, that I notice is it's kind of a, you think about the skinny woman doing yoga is like self care, but self care is so contingent upon resources. So your self care, your possibility for self care activities is so much broader when you have resources. So when someone can babysit the kid, you can do a whole bunch of stuff, right? If you don't have anyone in your life that you trust to watch your kids for good reason, then what you can do to take care of yourself is less. If you don't have financial resources, you can't join a gym or get a massage or do yoga. So I guess the way I think about self care is that it's thrown out there in this real like kind of cliche, simplistic. It's super, super, super important, but it shrinks or expands in proportion to your resources. So when we talk to lower income women and I ask what they do for self care, I've heard things like, well, I work at Kroger, so when the flowers go on discount at Kroger, me and my daughter will make flower arrangements in our house. And I thought, that's amazing, right? That is like an incredible application of self care when you don't have resources. Because I don't know if I've shopped for flowers at Kroger when they go on discount. They could be like anywhere from like $1.50 to, $7. You can get this nice brand new flower. So my point is, she didn't need a babysitter. She didn't need a lot of money. And that was something that was soothing. One woman told us she bakes with her kids, and that's like soothing to her. Again, didn't require a babysitter, doesn't require a lot of money. But you have to be a little more creative when you don't have resources. Just it's a sad fact that self care. We have to be real careful when we think about it, which is part of resilience. That's kind of rolls right into the whole idea of resilience and coping, because self care is part of coping. Is that it again, it shrinks or expands in proportion to your both resources in terms of human capital and your financial resources. I mean, there's even a huge difference in if you're educated, you're around other educated people, chances that the screening age for colonoscopies has changed from 50 to 45 is much greater. So it's like kind of baked into who your social circle is. The same way, the variety of self-care activities is is wrapped right around, your socioeconomic status.
How does your research define extreme weather? Is it based on the amount of damage that occurs, or is it monetary, or
No, actually, when we do the literature search, we look for like we get the regular set of extreme weather events like wildfires, cyclones, tropical storms. When I first started, because my area has been maternal functioning and postpartum depression, and when I sort of got really focused in on this idea was again when my kids started coming home saying things like, Mom, what if all the bees die? What if all the bees die? I thought, man, I was never thinking about like the end of the universe at my son's age, you know? So the fact that that's on their radar made me sensitive to the idea that, you know, this is impacting how moms and kids think. Now, if you're not aware, you don't believe in it, in a way, you're probably better off. In a way, like ignorance is bliss in that, in some ways. On the other hand, if you're aware, you know to think about, is this summer camp going to handle extreme temperatures well? You know, do they know how to handle this? Um, I'm sorry. And what was your question? I totally not sure. Oh yeah, yeah. So we talked to, because that was my focus, was perinatal mental health, and I just got real interested in how moms were handling the idea of climate change, because I knew it was like building like I had this core area of research. It was like building a new line. And because of that, I brought in a person who was a general established climate change researcher. And she told me, you need to put these search terms in. You know, here's how you want to define extreme weather. And she gave me a list of like, you know, I don't know, 7 to 10 different types of events to put in. And that's how we pulled extreme weather. So there was no economic impact consideration. And the other thing is, if you did that with the way the literature base stands right now, you'd have like probably fewer studies, because this isn't like cardiology, you know, open heart surgery. This hasn't been around long enough to have the richness of data that you have in fields that have a lot more years behind them. So if you got real selective, like you try to look at, you know, like how in systematic reviews, you can get real specific. You want to look at clinical trials with this patient base, this exclusion criteria. You can't really do that in climate right now. Becca, would you say that's true? Yeah. You have to be a little bit, you know, we looked at quality. We looked at what women said about how they felt. They even talked about their evacuation centers. Like, I'm pregnant and I'm in this evacuation center that's like not hygienic, and I have my family here, and I'm, you know, so like that level. But maybe that were 30 people in that study. So I didn't put real, if you put real specific parameters in a subject that's early stage, you're going to get like very few hits. So we were more liberal in what we considered.
All right, let's give one final round of applause to Dr. Barkin. Woo!
We hope you enjoyed this presentation. For more information on Science for Georgia's mission and our past work, visit our website at scienceforgeorgia.org.